Advanced Insulin Injection Technique and Education with FITTER expert recommendations.
Welcome to The Explainer. Today, we're tackling something that is literally a daily reality for millions, but rarely gets the spotlight it deserves. We're diving into the hidden crisis in everyday diabetes care. But more importantly, we're going to empower you with the latest solutions. We'll be walking through the 2025 FITTER Forward recommendations. These are brand new, evidence-based guidelines created by a global panel of experts, and they are designed to completely transform how we think about and actually perform insulin injections. All right, let's kick things off with a statistic that honestly might blow your mind a little bit. It really normalizes the struggle. In recent surveys of people living with diabetes, 100% of them, literally every single person surveyed, made at least one injection error. So hey, if you've ever felt unsure or experienced any discomfort with your daily routine, you are absolutely not alone in this. Which brings us to Section 1, the hidden injection problem. We really want to reframe this daunting daily task of insulin injections as sort of a hero's journey, you know? You just need the right tools and training to conquer the challenges of the disease. But here's the root of these errors. Get this. Less than 40% of patients actually received proper injection instructions from their healthcare providers in the past 6 months. Less than half. That is a massive knowledge gap, and it's a gap that leads to unnecessary pain, skin complications, and poor glycemic outcomes. But, well, that's exactly what this explainer is here to fix. Moving right along to Section 2, the science of the needle. Now, what's really interesting here is that how you deliver your insulin is just as important as what you're delivering. Take a look at this cross-section of the skin. See that yellow layer right in the middle? That's the subcutaneous tissue. That is our Goldilocks zone for insulin absorption. It's absolutely perfect. Notice how the 4mm needle reaches that zone beautifully? The longer 8mm needle, on the other hand, punches straight through into that red muscle layer at the bottom. And you definitely don't want that. Injecting into the muscle accelerates absorption way too fast, and honestly, it's incredibly painful. The 4mm needle completely avoids that issue. So, to hit that Goldilocks zone every single time, you need the right tools. Here is your ultimate needle checklist. First up, you want a 4mm length. Second, a 32-gauge width. Now, gauge just refers to thickness, and 32 is ultra thin, which really helps reduce pain. Third, look for a 5-bevel tip geometry. That just means the tip has 5 microscopic cuts, making it incredibly sharp. And finally, you want a contoured base. A contoured or flat base widely distributes the pressure against your skin when you press down, and that prevents the bruising and indentations you'd get from those older post-style bases. Because really, it's all connected. This overview perfectly sums it up. When you combine the right device characteristics, like that thin, sharp 4mm needle, with a solid understanding of your own unique bodily physiology, you drastically reduce the physical injection force. And it's simple. Less force means less pain, and a vastly improved daily experience for you. Okay, let's dive into Section 3, perfecting the injection process. Now that we've got the optimal tools sorted out, let's put the science into motion and master the actual physical action. By following this rhythmic 1, 2, 3, 4 checklist, you can transform what feels like a stark medical procedure into an easy, actionable daily routine. Step 1, ensure your insulin is at room temperature so you don't shock the tissue. Step 2, prime the pen until you see a drop at the tip. This just makes sure there's no air in the needle. Step 3, inject straight in at a 90-degree angle. And step 4, this is crucial, press the button and hold for a slow count of 10 seconds before pulling out. That 10-second hold, that is the secret to preventing your insulin from leaking right back out of the skin. But we also need to talk about a key technique variation. While that standard 90-degree insertion on flat skin works perfectly for most adults using a 4mm needle, sometimes a modified skin lift approach is necessary. By gently pinching the skin to lift the fat away from the muscle, you create a much safer target. This is absolutely crucial for people with a lower body mass index, for children under 6, or if you happen to be using older, longer 6mm syringes.
Let's explain the insulin injection technique.
Pull the pen cap straight off. Check the liquid in the pen. Traceba should look clear and colorless. Do not use it if it looks cloudy or colored. Select a new needle. Pull off the paper tab from the outer needle cap. Push the capped needle straight onto the pen and twist the needle on until it is tight. Pull off the outer needle cap. Do not throw it away. Pull off the inner needle cap and throw it away. Priming your Tresiba Flex Touch pen. Turn the dose selector to select 2 units. Hold the pen with the needle pointing up. Tap the top of the pen gently a few times to let any air bubbles rise to the top. Hold the pen with the needle pointing up. Press and hold in the dose button until the dose counter shows 0. The 0 must line up with the dose pointer. A drop of insulin should be seen at the needle tip. If you do not see a drop of insulin, repeat this priming procedure no more than 6 times. If you still do not see a drop of insulin, change the needle and repeat the priming procedure once more. Selecting your dose. Tresiba Flex Touch Pen 100 units per milliliter is made to deliver the number of insulin units that your healthcare provider prescribed. Do not perform any dose conversion. Check to make sure the dose selector is set at 0. Turn the dose selector to select the number of units you need to inject. The dose pointer should line up with your dose. In this example, 5 units are selected. If you select the wrong dose, you can turn the dose selector forwards or backwards to the correct dose. In this example, 24 units are selected. The even numbers are printed on the dial. The odd numbers are shown as lines. The Tresiba Flex Touch Pen insulin scale will show you how much insulin is left in your pen. To see how much insulin is left in your Tresiba Flex Touch Pen, turn the dose selector until it stops. The dose counter will line up with the number of units of insulin that is left in your pen. If the dose counter shows 80, there are at least 80 units left in your pen. If the dose counter shows less than 80, the number shown in the dose counter is the number of units left in your pen. In this example, there are only 52 units left, so the dose counter stops and you can't dial past 52 units. Giving your injection. Inject your Tresiba exactly as your healthcare provider has shown you. Your healthcare provider should tell you if you need to pinch the skin before injecting. Tresiba can be injected under the skin, subcutaneously, of your upper legs, thighs, upper arms, or stomach area, abdomen. Rotate your injection sites within the area you choose for each dose. Do not use the same injection site for each injection. Choose your injection site, thighs, upper arms, or abdomen, and wipe the skin with an alcohol swab. Let the injection site dry before you inject your dose. Insert the needle into your skin. Make sure you can see the dose counter. Do not cover it with your fingers. This can stop your injection. Press and hold down the dose button until the dose counter shows 0. The 0 must line up with the dose pointer. You may then hear or feel a click. Keep the needle in your skin after the dose counter has returned to 0 and slowly count to 6. Count slowly. 1, 2, 3, 4, 5, 6. When the dose counter returns to 0, you will not get your full dose until 6 seconds later. If the needle is removed before you count to 6, you may see a stream of insulin coming from the needle tip. If you see a stream of insulin coming from the needle tip, you will not get your full dose. If this happens, you should check your blood sugar levels more often because you may need more insulin. Pull the needle out of your skin. If you see blood after you take the needle out of your skin, press the injection site lightly with a piece of gauze or an alcohol swab. Do not rub the area. Carefully remove the needle from the pen and throw it away. Do not recap the needle. Recapping the needle can lead to needle stick injury. If you do not have a sharps container, carefully slip the needle into the outer needle cap. Safely remove the needle and throw it away as soon as you can. Do not store the pen with the needle attached. Storing without the needle attached helps prevent leaking, blocking of the needle, and air from entering the pen. Replace the pen cap by pushing it straight on.
All right, on to section 4, the danger of lipohypertrophy. Let's see how all this builds into protecting yourself from the main villain of our story. Beyond just everyday pain, poor technique leads directly to a mechanical tissue complication. And let's just demystify this scary medical jargon right now. Lipohypertrophy simply means damaged fat tissue. It usually presents as these rubbery, thickened bumps under your skin. Since insulin actually acts as a growth hormone for fat cells, repeatedly injecting into the exact same spot causes these masses to grow. And if you keep injecting into them, your insulin absorption becomes highly erratic and dangerous, which leads to completely unexplained blood sugar swings. No thank you. So how exactly do these bumps form? Well, here are the 3 main culprits. Number 1, needle reuse. Reusing a single-use needle dulls its sharpness and strips away its microscopic silicone lubrication, which literally tears the tissue. Number 2, injecting cold insulin directly from the fridge. That completely shocks the tissue. And number 3, a lack of site rotation. Doing these 3 things will fast-track the development of those problematic bumps. So the crucial point here is defense. Systematic site rotation is your best shield. You want to divide your injection zones, like your abdomen or your thighs, into quadrants. Use one quadrant for an entire week, then move on to the next. And within that quadrant, always make sure to stay at least 1 centimeter, so about 1 finger width, away from your last injection site. This ensures consistent absorption and gives your skin the time it desperately needs to heal. Oh, and a quick pro tip, never inject through clothing. You literally need to see the skin to protect it. And remembering to adapt your technique to your specific body type is another massive step in preventing underlying tissue damage. For older adults with fragile skin, someone with a low BMI, or if you're managing diabetes for a child, using that skin lift technique we discussed earlier pretty much guarantees you hit the safe tissue, preventing any accidental trauma to the muscle below. Which leads us nicely into section 5, empowering better diabetes care. As we zoom out from the micromechanics of needles and tissue layers, we really need to look at the big picture ecosystem of your healthcare journey. This slide brilliantly illustrates that effective diabetes care isn't just clinical, it is deeply human. The FTT Forward Guidelines urge healthcare providers to address your clinical skills, yes, for sure, but also your emotional barriers, like a very real fear of needles. And even your social framework, like your access to proper resources, affordable pens, and daily lifestyle constraints. It's a truly holistic approach to care. The big takeaway here, you can have the best, most advanced insulin in the world, but your delivery technique is the actual key that unlocks its power. Equipped with the right thin, sharp needles, that rhythmic 1, 2, 3, 4 daily routine, and disciplined site rotation, you're no longer just passively managing a condition. You are fully empowered to advocate for your own health, maximize your medication, and completely minimize discomfort. So I want to leave you with this final thought to reflect on today. Take a quick look at your injection sites tonight. Think about your current needle gauge. Are your daily habits helping your insulin do its job, or are they hindering it? I strongly urge you to take these FITTER-forward strategies, apply them to your daily life, and step confidently toward a healthier, much more comfortable tomorrow. Thanks so much for hanging out for this explainer, and keep learning.